Alright, meds I didn't think I would see so often in the hospital, part 3. The next one is R-formoterol. So R-formoterol is a LABA, long-acting beta agonist, beta 2. It is the R isomer of formoterol. Formoterol is a racemic mix, and it's in Dulera and Symbicort actually. I mentioned what enantiomers are in my enantiomer video. It's in my medicinal chemistry playlist, but these two inhalers are actually ICS LABA combo. Inhaled corticosteroid, the mometasone and the budesonide, and then that LABA, long-acting beta 2 agonist formoterol. These are used for asthma. What I've mentioned before. What's interesting with these two inhalers is that they're not only maintenance inhalers, but they can be used as emergency inhalers. You cannot do this with Advair. That's because the onset of action of formoterol is similar to albuterol. So Materol is an Advair and it takes too long. But anyway, I didn't really think about this or really think about how it existed. I don't know. But I guess when patients are admitted with Symbicort or Dulera, they're expensive inhalers, right? So they're switched to basically nebulizing solution. So budesonide and R-formoterol. What's interesting is that this is refrigerated. Another drug that I didn't think I would see so much is Alteplase. This is basically TPA or tissue plasminogen activator. It's a fibrinolytic, a clot buster. So basically what comes to mind when you think of Alteplase is, oh, strokes, maybe heart attacks. But I see it more often than I thought I would because they also use it when lines get clogged. So they put it in as a little dwell to break up little clots, catheters. So this isn't a much lower dose, but this is for catheter clearance and suspected or confirmed thrombotic occlusions. Kind of interesting. Another drug I didn't think I would see so much of was Sabazilin. This covers MSSA and strep. It's usually for surgical prophylaxis, so to prevent an infection when you're cutting into someone and doing surgery. Another random little drug is sodium ferric gluconate. I learned about IV iron years ago, in 2019, I think, long time ago. I haven't seen those since my lectures, and now I'm seeing them again in the hospital. And last but not least, naloxone. These will be ordered as PRN or as needed orders, just in case if patients get over sedated after surgery. The doses are different if you want a full reversal versus a partial reversal. So you usually don't want to blast the patient out with a full dose naloxone if they're just coming out of surgery or if they're chronic pain patients. When you don't want total reversal, you might see a dose 0.4 milligrams, 2 milligrams IV for total reversal.